Are you struggling with neck pain and are curious about how to get relief from this condition? In this video, we'll explore cervical spondylosis, what is cervical spondylosis and how to deal with it. Keep watching this video till the end and don't miss out on the essential steps that can change your life. Understanding cervical spondylosis. Cervical spondylosis, commonly known as cervical osteoarthritis, is a common condition which usually affects individuals over 50 years of age. It is kind of a degeneration of the cervical spine joints, which causes pain and it may lead to pinching of the cervical nerves. It can range from a mild discomfort in the neck, a feeling of soreness or stiffness, to excruciating pain, and sometimes the pain may radiate down your arms and it may even cause neurological complications. What happens in cervical spondylosis? Cervical spondylosis is characterized by a gradual degeneration of the cervical discs, the cartilages in the cervical joints and the ligaments. Over time, these cervical discs lose their hydration and soft suppleness and they start to become hard. As the degeneration goes on, these discs become thin and leads to formation of osteophytes or bony spurs that can cause pinching of the nerves. These changes narrow the spinal canal and may lead to compression over the neural elements and cause neurological symptoms as well. What are the common symptoms of cervical spondylosis? Common symptoms include neck pain, neck stiffness, radiating pain, which may start from the neck and go down the entire length of your arm, and some people may mistake it for a myocardial infarction or a heart attack. There may be reduced range of motion of your neck, of your cervical spine, and in severe cases, nerve compression may lead to a lot of radiculopathy and neurological symptoms. It may cause pain, numbness, tingling sensation, etc. in the shoulders, arms, and hands. Some patients' grip also becomes weak. Causes and risk factors. The primary cause of cervical spondylosis is age-related degeneration, but there are some factors which can expedite the onset of cervical spondylosis. These are: there may be a family history of cervical spondylosis, jobs involving repetitive neck movements or heavy lifting can contribute to cervical spondylosis. Previous neck injuries, such as in sports or during work or lifting heavy weights on the head, may predispose a person to accelerated cervical degeneration. Prolonged use of computer or mobile devices, which is very common these days, is also a cause of cervical spondylosis. Smoking reduces blood flow to the bones of the cervical spine, and this may accelerate your cervical degeneration. Diagnosing cervical spondylosis. Diagnosing cervical spondylosis includes a thorough history and a thorough clinical examination of the patient by the doctor. Doctors check for signs of nerve compression such as abnormal reflexes, muscle weakness or sensory deficits. X-rays can reveal loss of disc height and bony spurs, and sometimes additional investigations like an MRI or a CT scan may be required. MRI and CT scan can give you a more detailed description of the disease process in the cervical area and may be required if plain X-rays are not enough to diagnose your problem. Management strategies for cervical spondylosis. Management for cervical spondylosis focuses on managing the symptoms, improving function and preventing further degeneration. Treatment options can be both non-surgical or in some cases surgical as well. First of all, we'll discuss about non-surgical management. Medications. Over-the-counter pain medications such as paracetamol, NSAIDs, etc. may be used to manage the pain in the initial stages. Sometimes muscle relaxants may also be needed to be given to a patient. Physiotherapy. It is one of the most important cornerstones of non-surgical management of spine conditions. Certain exercises may be prescribed to the patient to increase their neck and shoulder muscle strength, improve their flexibility, and promote a better posture. Techniques such as traction, ultrasound, or manual therapy may also be prescribed to the patient to relieve painful neck spasm and other painful neck conditions. Lifestyle modification is also a very important part, especially for those who are engaged in desk jobs or have to stare at a computer screen for a longer period of time. Avoid use of mobile while lying down, or keeping your neck in a same posture for prolonged period of time is of paramount importance. Using supportive pillows and posture improving techniques as well as exercises is a good way of preventing neck soreness and neck injuries. Sometimes some patients may need some sort of anti-inflammatory injections or nerve root blocks, or even sometimes facet or cervical spine joint injections to relieve them of pain of the cervical spine origin. Surgical management. Surgical management is to be considered only when the conservative management or the non-surgical management has failed to give adequate relief to the patient. Common surgical procedures, depending upon what is the underlying cause of your cervical problem, can be anterior cervical discectomy infusion, in which the disc which has bulged and is compressing the nerves is removed, and a bone graft or a cage is placed to support the vertebral bodies, and then finally a cervical plate is used to keep this entire fixture in position, is used to give relief to the patient. Cervical laminectomy is also another procedure which is done from the posterior side, where the cervical lamina or the cervical bone of the posterior part is removed to remove pressure on the spinal cord. Another surgical technique is artificial disc replacement, in which the degenerated disc is replaced by an mobile artificial disc. The aim of this surgery is to maintain the cervical motion, at the same time relieving compression by removing the offending disc from the cervical spine. Do you have any questions about cervical spondylosis or any cervical conditions or any other spine conditions which may be bothering you? You can always leave the answer in the comments. We will try to make an informational video and answer your queries in our next update. What are the key takeaways? Cervical spondylosis is a common degenerative condition which is seen in the older age group. Always the initial treatment is non-surgical, such as over-the-counter pain medications, anti-inflammatory medications, some sort of physiotherapy, and lifestyle changes. If these are not able to help the patient and the nerve root is getting pinched or there is some bony spur which is irritating the nerve roots, then surgical options such as discectomy, fusion, artificial disc replacement, or a laminectomy may be considered as appropriate for the patient's condition. Early diagnosis and prevention and lifestyle modification is a keystone in helping you get rid of the cervical problems and leading a more healthier and pain-free lifestyle. If you want to learn more, don't forget to check out our other videos on lower back pain and how to manage this condition. Thank you for watching. Don't forget to subscribe and like the channel so that you are always updated on the regular information material which we keep on publishing on our YouTube channel.